Welcome back. In Part 1, we covered glaucoma and hypertensive retinopathy, focusing on key clinical and physiological concepts. In this second part, we explored drug-induced visual changes, proliferative diabetic retinopathy, and age-related vision changes like presbyopia. Case 3. A 60-year-old man comes to the office for blurred vision in both eyes for the last 2 days. This worsens when he reads but is not noticeable when he drives. There are no associated symptoms. He reports that he started taking diphenhydramine several days ago for seasonal allergies. On physical examination, there is edema and clear drainage affecting the nasal mucosa. Fundoscopic examination is normal. The question here is, blockade of which of the following mediators is the most likely cause of this patient's visual symptoms? The correct answer is acetylcholine. This patient has impaired visual accommodation due to the anticholinergic or antimuscarinic effects of first-generation antihistamines, such as chlorpheniramine and diphenhydramine. However, they can also produce significant side effects due to blockade of other receptors, including alpha-adrenergic, serotonergic, and cholinergic receptors. The ciliary muscle attaches to the lens through zonular fibers. Contraction of this muscle reduces tension on the fibers, allowing the lens to become more spherical and increasing its refractive power. The ciliary muscle is under parasympathetic control from the Edinger-Westphal nucleus via the ciliary ganglion. Inhibition of this pathway by antimuscarinic agents limits accommodation and causes blurring of vision for close objects. The pupillary sphincter also receives parasympathetic innervation from the same pathway, and patients taking antimuscarinic agents may develop mydriasis. Case 4. A 60-year-old woman is evaluated for vision impairment. She has decreased vision in both distant and near fields, along with occasional floaters. She has no other symptoms. Her medical history includes type 2 diabetes mellitus, hypertension, and chronic kidney disease. Pupils are equal and reactive to light bilaterally. The anterior chambers are clear, and there are no opacities of the cornea or lens. Fundoscopic examination reveals scattered retinal microaneurysms, dot and blot hemorrhages, cotton wool spots, and new blood vessel formation. What is the diagnosis in this patient? This patient with painless vision loss and retinal neovascularization has proliferative diabetic retinopathy. The question asks, what contributes most to the pathogenesis of this condition? The correct answer is chronic hyperglycemia-induced microvascular injury. Diabetic retinopathy results from chronic hyperglycemic damage to small retinal vessels and is considered a microangiopathic complication of diabetes, along with neuropathy and nephropathy. Case 5. A 50-year-old woman who has had myopia for decades comes to the office for a routine physical examination. The patient has no chronic medical conditions and is excited because she may no longer need to wear glasses or contact lenses. Her visual acuity has improved. The question is, which of the following conditions has the same etiology as the change causing this patient's visual improvement? The correct answer is skin wrinkles. The improvement in this patient's myopia is likely due to age-related changes. Normally, during accommodation for near vision, contraction of the ciliary muscle relaxes the zonular fibers, allowing the lens to become more convex so that images focus on the retina. Starting around ages 40 to 50, most individuals develop presbyopia, which is the inability to focus on near objects. This occurs due to progressive denaturation of lens proteins and changes in lens curvature, making the lens less elastic and reducing its ability to accommodate. As a result, images of near objects focus behind the retina. However, in patients with mild myopia, where images normally focus in front of the retina, presbyopia can shift the focal point backward toward the retina. This can lead to a perceived improvement in vision.